Now, the Progressive Health Forum is once again urging government to address challenges in the health sector. Over the years, healthcare practitioners have complained about poor working conditions and a lack of staff, among various other issues. The forum believes that government needs to take urgent action to save lives. The convener of the Progressive Health Forum, Dr Aslam Dasoo, joins us now via our video link. Great to talk to you this morning. Dr Dasoo, thanks for coming on. I mean, where does one begin as we talk about the challenges in the healthcare sector in South Africa?
Yes, well, I presume this is a follow-up to the article we wrote this past weekend. This is kind of a long series of laments about our public health system, and what we sought to do was actually to do two things. One is to describe the actual narrative over the last 20-odd years, arising from the fact that right now, when people look at it, it looks like a convoluted mess, and people go down rabbit holes in discussing it, but there is a clear narrative about how we got here. And the second thing is about what do we do now, and what are the conditions at the moment. And I think what has happened is a spontaneous reaction from health workers themselves, which is quite unprecedented, about the state of the public health system, and specifically about the public health system, which is, of course, the primary healthcare system for the country.
I mean, you talk about what's been done over the past 20 years, or what's been undone over the past 20 years, but we just need to look over the past year. If we look at Gauteng's healthcare system and the various challenges plaguing us here just in this province.
Sure. So, these things take time and they develop slowly, and then things just break down quickly thereafter. And I think that's what we're experiencing now in Gauteng, certainly. We've had this problem, of course, in the Eastern Cape, and it was really the pandemic that revealed the full extent of the dysfunction that we face in practically all the provinces. And this has been, the result of several things. One is, of course, the failure of the government to keep up the correct funding levels for the public health system and to keep its staffing levels correct. And also, of course, the kind of neglect that management has had over the public health system. And it's a real worry when the president decrees that there's going to be 10 SIU deep dive investigations, 11 deep dive investigations into government departments, and 10 of them are health departments, the 9 provincial and the national, which indicates that this has been a happy hunting ground for the corrupt. And that's part of the problem here. But what we saw this year was kind of a desperation on the side of the administration. When health workers started speaking out, like the pediatrician at Rahima Musa, the reaction was, was actually one of desperation. Suspend him and keep things quiet because people are being found out here. Well, you can't keep this thing under wraps. This is the public service. There are many constituents. You can't hide anything. And everything is coming now to the fore. What we do need, of course, as we see with breakdowns in other state agencies, whether it's ESCOM or roads, etc., which all suffer pretty much the same malaise as the public health system, is a Marshall Plan for the system.
Let me ask you this, Dr. Dasoo. You've given us a broad outline and a detailed outline of the healthcare system since 1997, when Parliament adopted the policy framework for healthcare in a post-apartheid South Africa, all the way to 2007, and how our response to the HIV/AIDS pandemic, how our response was scuppered by certain policies insofar as ARVs were concerned. Fast forward to COVID-19, we saw healthcare systems around the world, in first world countries, in developed nations as well, buckling under the strain of the pandemic. Is it fair to say that we held up reasonably well here in South Africa, or was it a case of healthcare practitioners propping up a buckling system?
Well, it depends who you compare South Africa's health system with. The public health system certainly took huge strain. It was poorly provisioned from before the pandemic, and of course the pandemic just created intolerable stresses. And I think the fact that South Africa suffered one of the worst death rates in the world, says its own story here. But I do think that the reason we suffered only the deaths that we did was our health workforce going above and beyond the call of duty and putting their lives on the line. And we saw over 1,500 of them lose their lives in the line of duty over these past couple of years. And I think the fact that the system still functions at the level that it does is entirely due to that health workforce keeping it up. I can assure you that it's not the result of better provisioning by the government or anything of the sort. You may recall that when we had the first lockdown, the extensive one, the idea was to strengthen the public health system for the storm that was to come. There was nothing of the sort. We were pretty much in the situation we were from before the lockdown. And I think this is the problem between the promises made and whether they are kept. They obviously weren't. So now, given the fact that also in certain provinces, hospitals have been taken out of the system because of breakdowns and fires like we have here in Gauteng. And what that does is that it just distributes the load onto other stressed facilities. And they're going to buckle, as they are. And so unless there is an intervention of the order now that we've seen, say, with ESCOM, for the public health system, this is a one-way ticket. And this is the system of healthcare for over 85% of the population. There's no getting away from it. You can blame the private sector all you want. The private sector does what the private sector does. If there is a market opportunity, it will respond to that. The market opportunity is created by the fact that health workers find working in the public system intolerable, and patients who have the means, who don't have to use the public health system, leave it. They vote with their feet to go elsewhere. So you can now chase the private health system, which is what is happening. And ignore what you're doing with the public health system. In fact, we are warned there's going to be a huge budgetary hit on the public health system as it stands right now because of the economic conditions the government faces. Unfortunately, I don't see that, of course, as helping at all, and I don't think anyone can. But what we must clearly not do, I think, is to take our eye off the public health system. And health workers there who keep it going are beginning to lose the reason to actually work in the system. And as they leave, their posts are defunded. They are frozen. People are not replaced. And we end up with a worsening situation all the time.
Certainly. And I mean, the crux of the matter is that it leads to a loss of life. Urgent action needed, says the Progressive Health Forum, to save lives insofar as our healthcare system is concerned. Dr. Aslam Dasoo, let me thank you for your time this morning.